fluoridation is a poor medical practice. It's a poor medical practice to use the water supply to deliver medicine for obvious reasons. Once you put it in the water, you can't control the dose, which is very important. Secondly, you can't control who gets it. It goes to babies, it goes to infants, it goes to sick people, it goes to elderly people, it goes to people with impaired kidney function, people with low iodine. It's ridiculous. Ask a pharmacist if there's any drug in his store that he can give to anybody in any dose. It's preposterous. And then we come to the ethics. What you're doing is forcing medication on people without their informed consent. There are people in this room who do not give their informed consent to this practice, but it is forced upon them.
What I've noticed is that I come to here at Phoenix College, they hand me bottled water. That's all I see with the middle class, the upper middle class, and the rich. Everybody's got bottled water. That's not what happens to the poor. In the poor, South Phoenix, the West Side, you know they only drink water. They don't have dental insurance. 8% of all emergency room visits are these people in pain. Water fluoridation has been smacking down decay for the poor.
You mentioned that they just had a different delivery system in Europe. 97% of the population in Europe does not drink fluoridated water. You said they fluoridated their salt. How many countries in Europe and which ones fluoridate their salt? You don't know. Well, but you just made a statement.
You can buy it at any store. I've lectured dentists in 40 countries.
Which countries? Which countries in Europe?
Well, just last month I was talking to a dentist. I went to Denmark. I went to Tallinn, Estonia. I went to St. Petersburg, Russia. I went to Berlin, Germany. I went to Helsinki, Finland. The month before that, I was in China. You can buy fluoridated salt everywhere I went, just like in Ireland, where they have the most.
The official statistics, maybe we can check this out. This is a good idea to really get this sorted out. But as my understanding is, there's only 4 countries in Europe that fluoridate their salt. Germany, France, Austria, and one other.
Those stores have 60,000 items. You can buy a Snickers bar in Shenzhen. Yeah. You can buy Ritz crackers. So if they sell the product, I mean, you walk into a store with 60,000 items, the consumer has access to those.
And you would agree that does give the consumer freedom of choice, because in all those stores they could buy non-fluoridated salt as well as fluoridated.
Yeah. And we could really raise our taxes to pay for Medicaid to cover dentistry, and Medicaid doesn't cover dentistry. So if you don't want to put it in the water and you don't want to buy bottled water, then raise taxes a lot, quit bad-mouthing Obamacare, and start paying for all these poor kids to come in and get dental treatment.
Yeah, it's very interesting that you stressed poor children. It's a very emotive argument. Very emotive. I think it's the most powerful argument for fluoridation. We're doing this for poor kids. But before you take that at face value, 80% of dentists in the United States do not treat children on Medicaid. And before you believe that you're doing a favor to poor kids, remember this: it's precisely poor families who cannot afford to avoid fluoride if they want to. They cannot afford all this bottled water or reverse osmosis. And next, we know from studies in India and China that the most vulnerable to fluoride's toxicity are those with poor nutrition. Low calcium, low magnesium, low vitamins, low protein. Where are you most likely to find poor nutrition in the United States? Answer: in low-income families. So this well-intentioned policy of targeting poor families, it is well-intentioned, is having, I think, a pernicious effect, because you trap this community, they can't avoid what you're doing, and secondly, it's worse for their children than for other children with better diets.
But look at the cost savings. For most cities, every dollar invested in water fluoridation saves $38 in dental treatment. You guys are $16 trillion in debt. And the Republicans still don't want to raise taxes. Now, if $1 invested in water fluoridation prevents giving me $38, and again, we're talking about the poor. We're talking about the lower socioeconomic. You don't want fluoride in the water? You could drive down here, sit in Phoenix College after work, then go buy bottled water. But who's going to pay for the little 2-year-old girl who's in the emergency rooms when 8 out of 100 visits in just Arizona are from that? It benefits everyone. Again,
Comment on a few things you just said. That study about for every dollar you save $38, real bit of junk science there. They didn't include the cost of dental fluorosis. Remember, we have 41% of kids 12 to 15 have dental fluorosis. They didn't count the cost of any other health effect because they ignore all that. But they did funny things like assuming that the loss of work at $15 an hour loss of work with tooth decay. But that doesn't apply to children. So there are huge weaknesses in that.